I honestly hope that every time I attend clinical, I have provided patient focused quality care. And I hope that my patients feel that way too. So, one specific example I'd like to share is I had a patient who she had came in baseline with a mental disability, and the reason that she had been admitted was because her normal ability to function was decreased. And one of her family members came. The patient lived in a group home, and one of the patient's family members came and recognized that she had had a significant decline from her normal capabilities, even with that mental disability. So she came in. They couldn't really figure out why. They just kind of assumed, after I went through the notes, that it was due to a UTI. The patient was elderly. But prior to her coming in, she was quite capable of getting up, moving around, going to the bathroom herself. And then when she came in, she was really needing a lot of help ambulating. They were like, maybe she had some sort of stroke activity along with the UTI, not really sure. But she had been doing better on antibiotics, and they were able to migrate towards discharging her home. So when I came in to care for her, she had a PureWick set up, and there was no urine in the receptacle. And she also had a caretaker there who came from the group home that she lived with. So I was able to ask a lot of information and just kind of get a lot of information about the patient, about her home life, about what her normal baseline is, what type of support she would need to be able to be discharged. So the caretaker was really, really helpful and informative and gave me a lot of really good information. So I also went through the active orders, and so obviously the patient had the PureWick, was not collecting any urine off of that. And so I did talk to the caretaker, and she was like, she hates that thing. She won't pee. And I'm like, well, if this patient can hold it, do we need a PureWick? So I checked with her nurse and made sure that it was fine, that I discontinued it. But in doing so, I also, was quite obvious that she did not have seizure precautions set up. So I went through all of her active orders and made sure that they were all in place. I set up the seizure precautions for her. And as we were kind of, migrating, taking care through the day, I helped her ambulate on a regular schedule to get up to the bedside commode, just so that way we decrease the chance of a repeat UTI and get her onto like a regular schedule for going to the bathroom. I was able to also kind of assess her mobility, and it was concerning because I didn't feel like she could be discharged without support. So I checked with that caretaker, and she said, I think somebody's supposed to be coming. They didn't want to keep the patient at the hospital because they didn't feel like that was good for her. They want her back in her regular environment. And so I went to the coordination of care and made sure that she had some sort of home health coming to help her, whether it was PT, some sort of therapy coming to the house to make sure that she was getting the support that she needed. And I also talked to the caretaker about what type of walker that they had, because she was using a good one at the hospital, but it was the hospitals. And so I asked her if she had one at the house, at the group home, and she said she did, but it was very sketchy. Like, it was very unstable. And so I went back to the care coordinator and I said, what can we do for this? And so she said, oh yeah, we can talk to the doctor and get a prescription. And so I kind of got those things in place. I also ran into the person who was going to be in charge is like the company that they hired to be in charge of her therapy at home. And so I kind of escorted him to her room, ensured that it was the correct person, all of that, but made sure that link had happened. So I don't feel like that was going above and beyond my expectations. I feel like that was fulfilling my whole role as a nurse to make sure that the patient was cared for, both medically in the hospital and also having the support that she needed post-discharge to ensure that she was able to make a successful improvement. And I also took the time to print off some information regarding UTIs. So I think because her baseline prior to hospital admission had been pretty independent, pretty capable of going to the bathroom when she needed to, moving around, I wanted to make sure that the caretaker knew why it was so important to get this patient on a regular schedule for bathrooming and ensuring that she doesn't get caught up in something super fun that they're doing in the group home and that she actually goes and takes the time and goes to the bathroom. And also the signs of a UTI in an elderly patient. So I printed off some information, went over that with her just to make sure that they had both the support and the education that they needed to be able to support this patient after discharge.